I haven't made really any comments about COVID or the lockdown and whatever else is going on in what is called a pandemic. I don't want to offer myself as any kind of an expert, but a rather telling report came out this week, and for the first time, we heard the truth. The CDC, the Centers for Disease Control, which is the national organization, government organization that is to report to us the truth about disease, said that in truth. 6% of the deaths that have occurred can be directly attributable to COVID. 94% cannot. Of the 160,000 people that have died, 9,210 actually died from COVID. There is no pandemic.
That was Pastor John MacArthur at the beginning of his sermon yesterday, citing some information that is very popular right now, is going around, spreading all over the place. People are talking about this from the CDC. And I wanted to show you what the CDC website says that Pastor MacArthur is referring to, comorbidities. It says Table 3 shows the types of health conditions and contributing causes mentioned in conjunction with deaths involving coronavirus disease 2019. For 6% of the deaths, COVID-19 was the only cause mentioned. For deaths with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or causes per death. The number of deaths with each condition or cause is shown for all deaths and by age groups for data on comorbidities. So they have provided a table showing that information. And basically, it backs up something that people have known for a long time. A lot of people have realized that when people die with COVID-19, it doesn't necessarily mean that that was the only thing contributing to their death. There may have been other things, comorbidities, things that make you more vulnerable. So that we've kind of known. And then this article here from a news site gives some supplementary information on this. 94% of COVID-19 deaths had underlying medical conditions. It does cite the same information I was talking about from the CDC website. And at the end here it says, the following are the top underlying medical conditions linked with COVID-19 deaths: influenza and pneumonia, respiratory failure, hypertensive disease, diabetes, vascular and unspecified dementia, cardiac arrest, heart failure, renal failure, intentional and unintentional injury, poisoning and other adverse events, other medical conditions. According to the CDC, 9,683 died in the United States with only having COVID-19 listed on their death certificate. So Pastor MacArthur is saying, in light of information like this, there really is no pandemic. And I know a lot of you would agree with that assessment. And it's true that COVID-19 isn't really the only thing contributing to a lot of the deaths. But it was interesting for me to hear a doctor's perspective on this information. And I'm going to play some of it for you just because I think it kind of helps clarify the information and helps us to think through it a little bit more clearly. Now, before I show you what this doctor says, I think a very important thing for me to say about him is that this doctor is actually someone who thinks that the lockdowns probably weren't very wise and there were problems with taking that approach. So he's been actually critical of the lockdowns and of a lot of the approaches, and he's admitted that the scientific community and the government has made mistakes in dealing with the virus situation. But he says we do need to look at what the CDC is giving us accurately. We need to convey this accurately as we are giving criticism to the situation. So that's basically the context, the background of this doctor, and I'll let you hear some of what he says.
6% of the death certificates said COVID, and that's it. Now that could mean that other people, that the people filling out the death certificates weren't complete. They didn't put all the other stuff, or COVID-19 was the only thing they had, and there were no other comorbidities, other diseases that the person had, and they truly died purely of COVID, and that's a real tragedy because we don't typically see that unless you're quite old, which was the majority of deaths, by the way, older people. All right, great. Next, what about all these other things, right? Well, just because you have diabetes and hypertension doesn't mean those killed you and you also had COVID. The opposite is most likely true because we know this from the basic physiology of how COVID works. It tends to affect people who already have other diseases like diabetes, hypertension, obesity, lung disease, immune compromise, cancer, things like that. And those people are particularly vulnerable to the effects, and they tend to die of the COVID because of their comorbidities, not with COVID and dying of the comorbidities. So, and if you don't believe that, if you still think, no, this stuff is falsified, people are just putting COVID on the death certificates, look at the overall excess death rate in the country. And I did a video on this already. The number of people that are dying overall of any cause versus the number you expect to die based on previous years at the same time of year. We have a huge excess mortality that actually exceeds the number of documented COVID-19 cases, which means either we're undercounting COVID or there's other things due to our lockdowns that are actually costing lives.
So I know there are a lot of people that would agree with Pastor MacArthur in saying that really this whole pandemic situation is hyped up and that there are a lot of lies with it. And, there is a lot to be said for things being taken out of proportion and overblown, and certainly political purposes and aims being behind certain things. I think this doctor actually admits that. But at the same time, there are things that we have to be honest about in terms of some of the danger levels in certain situations, and so we want to be realistic. I know people have very strong opinions about this situation, and I know I'm going to hear that in the comments, but I just wanted to give you some information that might be helpful. I will leave links to Pastor MacArthur's sermon as well as to the video of the doctor that I showed so you can watch the full things for yourself. But I thought it would be interesting for the discussion and for all of our information to talk about this. I would like to hear what you think in the comments. Just try to keep those comments positive and edifying to helpful discussion. And as always, thank you so much for listening to what I have to say from A Frisch Perspective.